If you're over 60 and your doctor has ever told you this test is routine, nothing to worry about, you may want to keep watching, because what we're about to reveal may shock you. Across hospitals and clinics today, millions of seniors are being sent for tests that sound harmless, even helpful. But beneath the surface, some of these popular medical checkups are doing more harm than good. And here's the frightening part. They're not just unnecessary. Some are worsening joint pain, quietly spiking blood pressure, and may even be linked to faster memory loss in seniors over 65. Yet, doctors rarely warn you. Why? Because these tests are considered standard practice. Insurance covers them. Protocol demands them. And no one wants to admit that something routine might be hurting the people it's supposed to help. But when your knees hurt more after follow-up, when your blood pressure starts fluctuating after another normal screening, or when your memory seems foggy or weeks after that checkup, most seniors blame it on aging. But what if that wasn't it? What if one of those precautionary tests was stressing your organs, aggravating your nerves, or overloading your system without anyone connecting the dots? We dug through clinical trials, case reports, and patient experiences, especially those over age 65, to uncover what few dare to say aloud. There are at least 5 popular medical tests being recommended every day to seniors that may be silently damaging your health in ways no one tells you about. And the longer you stay in the dark, the more risk you may be exposing your body to. Now, let's be clear, not all tests are bad, but context matters. Your age, your history, your current medications, all change how your body responds to even simple procedures. And while some doctors are cautious, many push these tests without pause, out of habit, not necessity, which is why this video might just save someone's joint mobility, their blood pressure stability, or even their mind. Because here's the real fear. What if you've already taken one or more of these tests in the last year? What if you've already started experiencing side effects, but you chalked it up to aging, or worse? You felt too ashamed to question your doctor's advice? That stops today. This video exists for seniors who've been too polite, too trusting, or too scared to ask if that test was really necessary. This is for the 68-year-old woman who did what she was told and hasn't walked without knee pain since. For the 73-year-old man whose memory started slipping after a preventive scan and was told it's just normal decline. It's not, and it's not your fault. But what is your responsibility now is what you choose to do next. Because if you click away now, if you brush this off and go about your day, you may walk right into another test next week, thinking it's routine, only to come out feeling worse, or needing more medication, or scheduling another follow-up that leads to a new problem entirely. This cycle ends when you know what to ask, what to refuse, and what your body no longer needs after 60. And that's exactly what we're about to reveal. Stay with us through the final checkup on this list, because the number one most dangerous test for seniors is also the one almost every doctor still recommends annually. Yes, even the good ones. So if you've ever felt a strange twinge after a scan, or your blood pressure's never been the same since that routine test, you're not imagining it, and you're not alone. Before we dive in, a quick favor. If we disappeared tomorrow, would you notice? Every video we make takes over 30 hours. No scriptwriter, no sponsor, no million-dollar studio. Just real research, real heart, for people who've been overlooked. So if this helped you, if you learned what your doctor rushed past, if you felt heard, don't be the silent viewer. Be the reason we're still here tomorrow. Subscribe. This message has already found you, but there are other seniors who would also immensely benefit from this hidden knowledge. How can you help us reach them? Just tap the like button and subscribe. That way YouTube shows it to more seniors who desperately need this message. Be the reason someone else finds his gem today, just like you did. Thank you. Before we reveal the first test, what's one medical procedure you've always wondered about or felt uneasy doing? Leave it in the comments below. You might not be the only one questioning it. We read every comment, and your voice might help another senior speak up at their next appointment. Now, let's start the countdown. If you're over 65, your doctor may have recommended something called a DEXA scan, a test that checks your bones for signs of osteoporosis. It sounds helpful. After all, bone loss is common as we age, and catching it early should prevent fractures, right? But here's the twist that most seniors never hear. For many older adults, this test leads to overdiagnosis, anxiety, and harmful prescriptions that weaken your muscles and wreck your joints. Let me explain. Bone density scans measure how strong your bones are using a scale called the T-score. A score of -1 or lower equals osteopenia, bone weakening. Below -2.5 equals osteoporosis. But here's what recent research has uncovered. According to the U.S. Preventive Services Task Force, many seniors with slightly low scores are being prescribed medications they don't need, simply because of fear. A study published in JAMA Internal Medicine found that over 67% of seniors diagnosed with osteopenia after a DEXA scan were put on strong drugs, even though they had no fracture history and no symptoms. These drugs? Often bisphosphonates like Fosamax or Actinol, and they come with a hidden cost. What doctors don't always emphasize is that bone-strengthening medications can increase joint stiffness and inflammation, cause crippling thigh pain, or even femur fractures with long-term use, lead to gastrointestinal bleeding, dizziness, and in some cases, jawbone deterioration, osteonecrosis. And here's the kicker. For many seniors diagnosed with mild bone thinning, the risk of these side effects is higher than the risk of breaking a bone in the first place. So instead of protecting your health, this test might send you down a path of pills and pain, without any guarantee of benefit. Take Eleanor, 74, a retired teacher in Michigan. She went in for a DEXA scan during her annual physical. Her doctor told her she had borderline osteopenia and immediately prescribed Fosamax just in case. Within 2 months, Eleanor began experiencing sharp knee pain, especially during her morning walks. Her doctor shrugged it off as just aging, but it got worse. One day, she tripped slightly and her thighs snapped mid-step. An ER X-ray showed a spontaneous femur fracture. It was a rare but known side effect of the very drug she was given because of that scan. Her mobility hasn't been the same since. When her daughter dug deeper, she found dozens of similar cases and one constant. None of these seniors had ever broken a bone before being medicated. This isn't to say bone scans are always bad. If you have a history of fractures, family history of osteoporosis, chronic steroid use, a DEXA scan might be warranted. But if you're healthy, mobile, and simply aging, be cautious. Ask your doctor, what will we do with the results? Is medication the only next step? How much risk do I actually have a fracture? Too often, DEXA scans are ordered reflexively, and the real risks of the medications that follow are barely mentioned. This test plays into a deeper issue in senior health care. Fear-based prescribing. Doctors feel pressure to act. Patients feel pressure to comply. But between that test result and that first pill is a decision that should be made with full understanding, not blind trust. Bone health matters. But if the test meant to protect you leaves you stiff, anxious, and on lifelong meds, was it truly worth it? That's why this lands at number 5 on our list. And now, test number 4 is even more shocking. It's a procedure done routinely for heart safety, but it might be raising your blood pressure and overstressing your heart instead. Keep watching. You need to know this one, especially if you've ever felt faint or dizzy after leaving the cardiology office. If you're over 65 and have ever complained of chest discomfort, shortness of breath, or irregular heartbeat, even once, chances are your doctor suggested a cardiac stress test. It's often pitched like this. Just a precaution. We'll hook you up to a monitor, get you on a treadmill, and see how your heart responds. Sounds simple, right? But for many seniors, this routine checkup can trigger dangerous heart stress, false alarms, and even unnecessary surgeries. Here's what most older adults aren't told. According to a landmark review published in JAMA Internal Medicine, over 40% of seniors over 70 who undergo a stress test receive a false positive result, meaning the test suggests there's a heart problem when there isn't. This leads to a cascade of follow-ups, CT scans, angiograms, and in some cases invasive stent procedures or cardiac catheterizations, all from one treadmill test that your body wasn't built to handle anymore. What's worse, the risk of complication from these follow-ups grows with age, including kidney stress from contrast eyes, blood vessel damage, panic attacks and anxiety, increased blood pressure variability after the test, and in rare cases, heart attack from overexertion during the test itself. This isn't fear-mongering. These risks are well documented, but most seniors are never warned. Howard was 77 when his doctor said, "Let's do a stress test just to be safe." He'd mentioned occasional fatigue, which he chalked up to age, but his doctor insisted. During the treadmill portion, Howard became dizzy. His blood pressure shot up. He stumbled, and the test was stopped halfway through. That alone should have been a red flag, but the cardiologist said his EKG looked suspicious and referred him for an angiogram. 1 week later, Howard underwent a catheter-based imaging procedure, which revealed minimal blockage, the kind most seniors have and live with safely. But fear had already taken root. He was prescribed 2 new medications, a beta blocker and a blood thinner. Within weeks, Howard reported severe fatigue, brain fog, and a constant lightheaded feeling. The very symptom that started this cascade had now gotten worse because of the test that was meant to prevent it. After age 65, your heart, blood vessels, and nervous system become less tolerant of sudden exertion. Treadmill tests assume a level of cardiovascular resilience that many older bodies no longer have. But here's the rub. Doctors often use the same stress test protocols for a 70-year-old as they would for someone in their 40s. This mismatch creates inaccurate readings, misdiagnoses, and sometimes needless procedures that carry more risk than reward. If your doctor suggests a stress test, ask these questions first. Do I have symptoms that truly warrant this? Would a less invasive test, like an echocardiogram, give you enough insight? What will we do differently based on results? If the answers feel vague or overly cautious, pause. Also, ask whether your kidney function has been tested recently. If not, and you're heading for an angiogram, you could be at risk of contrast eye damage without knowing it. Many cardiology practices operate under the mindset of better safe than sorry. But that approach can backfire, especially with seniors. Because safe should never mean over-testing an aging heart to the point of harm. Some doctors also bill more for stress testing. Others rely on outdated guidelines. But you shouldn't suffer from the system's inertia. You deserve care that's right for your body, not a default setting. For many seniors, the worst part of this test isn't the treadmill or the wires. It's what follows. Weeks of worry, a pile of new medications, and the gnawing fear that something might be wrong, even when it isn't. That fear, it can raise blood pressure. That stress, it can impact memory. And that medication you didn't really need, it may quietly erode your energy, mobility, and independence. This is why the cardiac stress test lands at number 4 on our list. It's not the machine that's dangerous. It's the blind trust that often surrounds it. And the next test is just as deceptive. Medical test number 3 sounds like a memory saver. But for seniors over 65, it's been linked to cognitive decline, mislabeling, and even early nursing home placement. If you or someone you love has ever feared memory loss, you must see this one. If you've ever been asked a question like, "What day is it today? Can you spell the word world backwards? Do you remember these 3 objects? Apple, table, penny?" Then you've already taken part in a cognitive screening test. Doctors use these quick memory quizzes to spot early signs of Alzheimer's or dementia. It sounds responsible, forward-thinking, preventive. But for many seniors over 65, especially those with anxiety, hearing loss, depression, or simply a bad day, these tests may do more damage than good. Because here's what most aren't told. One low score can follow you for the rest of your life. In theory, early detection of cognitive decline is helpful. But in practice, according to a 2023 review published in the Lancet Neurology, up to 35% of seniors flagged by common memory screening tests were later found to have no actual dementia. That's right, 1 in 3 were misclassified. Why? Because these tests aren't designed for people with different education levels, don't account for cultural background or language nuances, can be thrown off by sleep deprivation, anxiety, or even a noisy waiting room. And once you're flagged, it goes into your chart. It can affect your insurance. It can lead to antipsychotic or cognitive drugs with severe side effects. And worse, it can change the way your loved ones treat you. Linda, 69, had always been sharp. Crossword puzzles, volunteering, book clubs. After a brief hospital visit for a knee issue, a nurse administered a quick MMSE as part of routine senior screening. Linda was groggy. She hadn't slept much. She confused the date and hesitated on a memory recall. Her score? 23 out of 30. Her file was marked mild cognitive impairment. She was never the same after that. Her daughter began checking in more often. Her friends started speaking slower around her. Her church group quietly stopped assigning her tasks. No one said anything outright, but everything changed. And Linda? She internalized it. She became quieter, less confident, more forgetful, not because her brain failed her, but because fear began doing the damage. This phenomenon has a name, label-induced decline, and it's real. Once flagged, many seniors are funneled into the world of cognitive enhancers, drugs like donepezil, Aricept, or memantine. These medications have mixed results in early cases, side effects like nausea, dizziness, confusion, and may interact dangerously with common senior medications. Worse, once started, they're rarely stopped, even if the original diagnosis was shaky at best. Now you're not just forgetting things. You're on drugs that make you feel like a patient, when you were never sick to begin with. Let's talk fear. Seniors fear memory loss more than cancer. A false label, even a subtle one, can cause withdrawal from social life, loss of independence, increased depression risk, and ironically real memory issues caused by isolation and anxiety. All starting with one precautionary test you didn't ask for. So what can you do if a doctor casually suggests, let's do a quick memory check? Ask these 3 questions first. What will we do if the score is borderline? Will this become a permanent part of my medical record? How will this result be used? And can I retake if I'm tired or anxious today? Also insist on context. Memory fluctuates. One bad day is in decline. Stress, dehydration, blood sugar drops, medications, and even loneliness can all cause temporary cognitive fog. You are allowed to advocate for yourself. You are allowed to say, not today. You are allowed to ask for second opinions. Many senior clinics are now incentivized to perform routine memory screens. It's easy. It's billable. But it comes at a cost that you carry emotionally, mentally, and sometimes even financially. And while early detection has its place, mislabeling someone too early can do the one thing we all fear most: convince a healthy mind that it's broken. That's why this test lands at number 3. Because once your memory is doubted, it's hard to get that confidence back. You've probably done this countless times. You're at the clinic. A nurse asks you to roll up your sleeve. They draw blood. You'll get the results in a few days. They say with a smile, it's also routine. Complete blood count, CBC. Metabolic panel. Kidney function. Liver enzymes, and of course, blood sugar, cholesterol, and more. But here's what almost no one tells seniors. When you test your blood too often or misinterpret the results, you risk doing more harm than good, especially after age 65. Routine blood tests can be useful in moderation. But according to a study published in the BMJ, British Medical Journal, up to 60% of seniors over 70 receive blood tests more frequently than medically necessary. leading to unnecessary medication adjustments, anxiety over false positive results, cascading follow-up tests that stress the kidneys, nerves, and blood vessels, even hospital admissions triggered by slight lab abnormalities that were never dangerous to begin with. In fact, many so-called abnormal lab values in older adults are completely normal for aging bodies, yet they're flagged anyway. And that's where the danger begins. One of the biggest culprits in over-testing damage? Contrast-induced kidney stress. Let's say a routine blood test shows a small dip in kidney filtration. The doctor gets concerned and orders a contrast-enhanced CT scan to be safe. That scan requires a powerful dye to visualize internal organs. Here's the problem. For seniors with even mild kidney weakness, these dyes can cause a condition called contrast-induced nephropathy, a sudden worsening of kidney function, sometimes irreversible. According to the National Kidney Foundation, seniors are the highest risk group for this condition. But the chain reaction starts with a simple blood test that didn't need to happen that month. James, 72, was active and relatively healthy, walking daily and eating well. During a routine physical, his doctor ran a full metabolic panel. No symptoms, just standard protocol. One number caught attention, a slightly elevated creatinine level, an early sign of kidney stress. James felt fine, but his doctor was cautious and ordered a contrast CT scan. After the scan, James began feeling sluggish. Within a week, he experienced nausea, swelling in his ankles, and difficulty walking. His kidney function had plummeted, and he was later told he'd suffered acute kidney injury, likely from the contrast dye. He now undergoes monthly nephrology appointments, all triggered by a test he didn't need, and a chain reaction no one warned him about. As we age, the body changes. Sodium levels shift. Creatinine creeps up. Liver enzymes fluctuate. But here's what should be happening. Doctors interpreting those results with age-adjusted wisdom and contextual analysis. Instead, too many providers treat seniors like they're 30, and any small deviation becomes a crisis. So you get more prescriptions, new diagnoses, adjustments that throw off your blood pressure, balance, and digestion. This is what experts now call the lab trap. A well-meaning test, a slightly abnormal result, a flood of unnecessary intervention. All because your blood looked off, even when you felt perfectly fine. Another hidden risk? Many seniors end up on unnecessary medications or dosage changes based on one blood test, without looking at the bigger picture. Blood thinners, blood pressure meds, diuretics. All can be adjusted too aggressively based on lab results alone. And this can cause dizziness, muscle cramps, frequent urination or incontinence, increased risk of falling. Suddenly, you're less mobile, more anxious, and wondering why you feel worse, when all you did was show up for a routine test. Blood tests also carry a mental weight. Hearing phrases like, "Your numbers are slightly off. Let's monitor this closely. We need to run a few more tests," creates low-level anxiety that doesn't go away, especially when you're not even sure what the numbers mean, just that something might be wrong. And for many seniors, that anxiety alone causes sleep disruption, appetite changes, foggy thinking, and yes, even higher blood pressure. Here's how to protect yourself. Ask your doctor, why now? What symptom or concern is this test meant to address? If there's no clear reason, it may not be necessary. Request age-adjusted interpretation. Your creatinine at 72 is not the same as it was at 45. Demand context. Push back on frequent testing. Annual blood panels are usually sufficient if you're stable. More than that, ask why. Say no to contrast scans unless urgent. If your kidneys are already strained, refuse contrast-enhanced scans unless absolutely life-saving. Here's why doctors still push this. Blood tests are easy, billable, seen as just playing it safe. But in seniors, that kind of thinking leads to over-monitoring, over-medicating, and sometimes over-hospitalization. And the most painful part? It often starts with zero symptoms. Just a test. just in case. That's why test number 2 is on this list. Because sometimes the quietest procedures create the loudest ripple effects. Let's not sugarcoat this. There's one scan, a seemingly routine test pushed on many seniors as they age, especially once memory lapses or mild forgetfulness start creeping in. It's often called a preventive measure. It sounds responsible. It sounds like peace of mind. But in many cases, it does the exact opposite. And this test is the FDG PET scan for cognitive decline, formerly known as fluorodeoxyglucose positron emission tomography. This scan is marketed as a high-tech way to detect Alzheimer's disease early by measuring brain glucose metabolism. Sounds smart, right? But here's the trap, and it's one that's caused many seniors not just peace of mind, but actual brain health. PET scans are incredibly sensitive. But in aging brains, that sensitivity becomes a problem. Why? Because natural age-related slowdowns in glucose metabolism, which are perfectly normal, can mimic patterns seen in early Alzheimer's. So even when there's no real disease, the scan may flag your brain as abnormal. A 2023 review in Frontiers in Aging Neuroscience found that PET scan findings often overdiagnose cognitive impairment, leading to unnecessary medication, lifestyle panic, and identity loss in otherwise healthy seniors. But it gets worse. Once someone is labeled possibly pre-Alzheimer's, they're often given risky dementia drugs with side effects like dizziness, agitation, and nausea, subjected to constant medical scrutiny and loss of autonomy, told to slow down or stop certain activities, which ironically accelerates cognitive decline. And all of that, it starts from one helpful scan. Let me tell you about Martha. She was 72, sharp as a tack, but had a few memory hiccups, forgetting where she left her glasses or mixing up the grandkids' names. Her doctor recommended an FDG PET scan, just to be safe. The results came back flagged. Suddenly, Martha was no longer a healthy senior. She was possibly pre-dementia. Her daughter took away her car keys. Her husband started finishing her sentences. She was prescribed an acetylcholinesterase inhibitor, and within a month, she was dizzy, nauseated, and fatigued. She started avoiding social gatherings. She became depressed. And ironically, her memory actually did worsen, not because of Alzheimer's, but because of the psychological and chemical fallout from a test that may never have been needed. You may want to ask, but isn't early detection good? Yes. When symptoms are clear, worsening, and interfering with life, testing can be helpful. But many seniors are being tested proactively, not because of a clinical need, but because of marketing pressure or vague concerns. And once that label sticks, you can't unhear it. You begin to act like someone with memory loss, and your brain, through a process called neuroplastic negative adaptation, can reinforce that behavior. In simple terms, you can mentally become the diagnosis you fear, even when the scan was wrong. PET scans also expose you to ionizing radiation, especially when paired with CT, which is often bundled in cognitive imaging. In seniors with weakened DNA repair systems, this raises the risk of cell damage, especially in sensitive brain tissues. Multiple exposures, even from non-invasive imaging, can quietly increase the long-term risk of cognitive injury or even trigger inflammatory processes. If you're noticing mild forgetfulness, first, assess sleep, hydration, nutrition, especially B12 and omega-3, and medication side effects. Try natural cognitive enhancers backed by real science. Lion's mane mushroom, ginkgo biloba, and aerobic movement routines. Use validated, non-radiation cognitive screeners like the Montreal Cognitive Assessment, MoCA, in consultation with a trained neurologist. And most importantly, don't panic. Forgetfulness is not the same as dementia. In fact, stress about your memory is one of the strongest predictors of memory loss. Stay calm. Stay curious. Stay informed. They told us we were just being cautious, that more testing equals better care. But that's not always true, especially after 70, because some of these popular medical tests, they don't test for disease, they create it. They create anxiety, strip away dignity, and push dangerous prescriptions onto people who are otherwise just fine. So ask the hard questions. Say no when you need to. And most of all, trust your lived experience. You know your body better than any scan ever will. So now you've seen the truth. Not the sugar-coated version. Not the hospital brochure. But the real picture of what millions of seniors over 60 are being pushed into on the guise of routine or safe medical testing. But here's the question we all need to ask ourselves. If some of these tests are quietly damaging our kidneys, stressing our hearts, draining our B12, shrinking our brains, then why are we still being told they're mandatory? Why are we guilted into them during rushed appointments? Why does no one mention the long-term cost until it's too late? Maybe it's convenience. Maybe it's profit. Or maybe no one's paying attention to what really happens after the test. But we are, because here on Senior Health Daily, we're doing something most health channels won't. We ask the uncomfortable questions. We challenge the default. We put your quality of life first, not pharmaceutical sales or lab referrals. And if you've ever felt like just another number at the clinic, if you've ever left the doctor's office more confused than when you walked in, if you've ever thought, I wish someone would just tell me the truth plainly, that's why we're here. For you, don't let anyone make you feel paranoid for asking about test side effects. Don't let anyone guilt you into silence when something doesn't feel right in your body. You've lived through more in 1 decade than most people face in a lifetime. You've earned the right to say no, to pause, to research before you're rushed into a tube, a needle, or a scan. Because the goal isn't just to live long. It's to live well, with strength in your legs, clarity in your mind, energy in your mornings, and trust in your choices. If any part of this video opened your eyes, even just a little, there are 2 things you must do to protect your future and the future of other seniors like you. 1, subscribe to this channel. Because the truth is, if we disappeared tomorrow, would you notice? Every video we make takes over 30 hours. No scriptwriter. No big sponsors. No $1 million studio. Just real research. Real heart. For people like you. People too often ignored by the system. So if this helped you, if you finally learned what your doctor rushed past, if you felt heard, valued, or even just seen for once, please don't be the silent viewer. Be the reason we're still here tomorrow. Subscribe. It's free, and it tells YouTube, hey, this content matters. 2, tap the like button and share this message. This video already found you, but there are other seniors out there, just like you, who are walking into medical tests every month, not knowing what might happen next. You could be the reason someone's kidneys are spared. You could be the reason someone's memory stays sharp. All it takes is 1 click. That thumbs up button, that subscribe button, that small act of kindness that tells the algorithm, show this to more people like me. You don't need to start a protest. You don't need to write a letter. Just tap, and you've already made a difference. Let's hear from you below. We want to hear from you. Have you ever had a test your doctor didn't fully explain? Were you rushed into something that made you feel worse, not better? Or do you have tips on what help you avoid unnecessary medical harm? Let us know in the comments. Your story could be the one that changes someone else's life. Because in this community, your voice matters. You're not just a viewer. You're part of something rare. A movement of seniors reclaiming their health with courage, with wisdom, and with choice. Now that you know the 7 tests to avoid, we've prepared something incredibly important for you next. Watch our video on 7 foods that reverse inflammation and joint pain after 60. It's the natural follow-up to today's topic, because while saying no to harmful tests is 1 step, saying yes to healing foods is the next. Don't miss it. It's the roadmap to getting your energy back, easing pain naturally, and staying mobile without medication. Thank you for being here. Thank you for spending your time with us today. Thank you for choosing to think critically, to take charge, and to help others by supporting this channel. We don't take your attention for granted. And remember this, You are not fragile. You are not fading. You are powerful, capable, and still in control of your body, your choices, and your future. We believe in you. We're with you. And we'll see you in the next video. Until then, stay strong, stay wise, stay free.